I'd like to introduce our first speaker, who is Frances O'Grady, Deputy General Secretary of the TUC and leader of their NHS campaign. Thank you, Frances, and welcome.
Thanks very much, Paul, and good morning, everybody. Thanks for inviting me to speak, and thanks to Keep Our NHS Public and the NHS Support Federation for organising this fantastic event. Friends, I'm very proud to bring greetings of solidarity from the TUC, proud to be amongst so many people who care passionately about the NHS, and proud to join you in speaking up for an NHS run by the people, for the people, and owned by the people. Conference, our NHS is special. The values that inspire it are enduring, and the public service ethos that underpins it is unique. And it's this vision of our health service, healthcare funded by all, accessible to all, depending on need, that we're here to defend. So I want to talk today a bit about the threats facing our health service, but also about the next steps of our campaign. It doesn't matter what background we're from, whether we're NHS trade unionists, campaigners, medical practitioners, or service users. We've got to work together, campaign together, fight together to save the NHS we all believe in. And if there's one message that comes out of the hall here today, if there's one single sentiment that we want to get across to those in the corridors of power, then let it be this: our NHS is not for sale. Today, tomorrow, never. Now, Conference, I don't need to tell you that the NHS is facing its gravest threat in its 63-year history. Back in 2004, Oliver Letwin reportedly told a private meeting that the, quote, NHS would not exist within 5 years of a Tory government coming to power. Well, he was wrong, because if we let this Tory government get its way, the NHS that we know and love won't exist by this time next year. We all know what we're up against: so-called efficiency savings of £20 billion, an ill-conceived Health and Social Care Act, and a series of reforms that nobody wants, virtually nobody supports, and certainly that nobody voted for. Cast your minds back to the last election. David Cameron said there would be no top-down reorganisation of the NHS. But now we have reforms that the chief executive of the NHS says are so big that they can be seen from out of space. David Cameron said that NHS spending would be protected, but now we have devastating real-term cuts, longer waiting lists, and over 50,000 NHS staff, including doctors and nurses, losing their jobs. And David Cameron said that the service would be safe in his hands. But now we have the biggest, most dangerous upheaval that the NHS has ever seen. And as a result of that, I would argue as a deliberate result of that, the steepest drop in public satisfaction within the NHS in 30 years. Now, the government's reckless right-wing reforms are designed to cause untold damage to our health service. They're wasteful because £3 billion will be spent on change rather than care. They're bureaucratic because the number of health service quangos will more than treble. And they are fundamentally unfair because with hospitals able to make up to 49% of their income from private work, NHS patients will be pushed to the back of the queue by those with the biggest checkbooks. Now, where we now have a genuinely national health service, if the government gets its way, the people of Britain will face a postcode lottery of provision. In many places, that's already happening. In Cornwall, Serco was able to provide just one out-of-hours GP for the whole of the county at the end of last month. In Kent, dementia patients receive dramatically fewer drugs than those in North Lancashire. And in Kingston, Surrey, a general practice run by one of the few prominent supporters of the reforms, Dr. Charles Alessi, was found guilty late last year of removing 48 elderly and disabled patients who were deemed too expensive to care for. If anyone wants to know what else is wrong with the government's plans, then I can sum it up in just 2 words. Andrew Lansley. He was the politician who, when in opposition, accepted a donation from John Nash, the founder of a private equity fund and owner of several private healthcare companies, the very same kind of companies which stand to be the biggest beneficiaries of the government's policies. Companies like Care UK, that had reduced its tax bill by taking out loans through the Channel Islands Stock Exchange. Then there's the likes of Circle Health, owned by companies and investment funds registered in the British Virgin Isles. Or Spire Healthcare, that has paid just £3 million in the last 3 years in tax, despite making an operational profit of £123 million in the last year alone. And don't even get me started on Virgin. Companies that make Jimmy Carr look like a model of tax-paying morality. So it should come as no surprise that Andrew Lansley wants money to be allocated to regions based on age rather than deprivation. In effect, transferring resources from the poor to the rich. Not just worsening health inequalities, but fragmenting the NHS. So what you get depends on where you live. Conference running through the veins of the government's reforms is a single poisonous philosophy: greater private sector involvement in the delivery of public health care. Where now we have collaboration, they aim to impose competition. Where now we have accountability to the taxpayer and the service user, they want accountability to the shareholder. And where now we have public provision, they plan privatisation on a scale that none of us have ever seen before. As services are opened up to any willing provider, private firms will look to cherry-pick the easiest, the most lucrative work, leaving the NHS to pick up the tab for everything else. And in a health service run on the basis of profit and loss, patient care will inevitably take a back seat. As the editor of The Lancet, Richard Horton, warned in March this year, and I quote, "People will die thanks to the government's decision to focus on competition rather than quality in health care." Let's be clear. These reforms are wrong for patients, wrong for the public, and wrong for Britain. We don't want an NHS run like Railtrack or Ryanair. We don't want private firms to choose which patients are economically viable to treat. And we don't want dedicated NHS staff to have their terms and conditions cut in order to boost profits. Conference, as anyone who's used the health service knows, the people who provide the health service do an outstanding job. The porters and the paramedics, the administrators and the ambulance drivers, the cleaners and the consultants, the night security and nurses, janitors and junior doctors. To a man and to a woman, what they do day in, day out, frankly, is amazing. And they deserve better than the shoddy treatment being meted out by this government of privilege and wealth. Jobs lost in droves, pensions attacked, and after years of pay misery, now the threat of the breakup of Agenda for Change with the imposition of regional pay. Divisive, unworkable, and just plain stupid. Our position is clear. You can't deliver world-class healthcare with third-rate terms and conditions. So whether it's winning a fair deal for NHS staff, whether it's resisting NHS privatisation or opposing NHS cuts, be in no doubt, we are in the fight of our lives. But I also want to send out a strong message today, because we may have lost the battle over the bill, but we certainly haven't lost the war. And our polling shows that the public is waking up to the fact that this so-called reform is nothing to do with reducing the deficit, it's got nothing to do with improving services, and it's certainly got nothing to do with giving more power to local communities. On the contrary, this has everything to do with a nasty right-wing agenda of turning patients into profits. But we won't be hoodwinked, and we won't give up the fight. The government wants us to believe that there is nothing we can do to stop primary care trusts outsourcing services. Not true. The government wants us to believe that so-called community interest companies work in the interests of, well, the community. Not true. The government wants us to believe that NHS bosses don't even have to hold a proper consultation. Not true. We can and we must challenge the fatalism that the government wants to take hold. We need to organise, we need to mobilise, we need to campaign. For the TUC's part, we're going to be continuing to up the case for a properly resourced, taxpayer-funded and publicly run healthcare system free at the point of use. A health service whose quality matches the dedication of the staff who deliver it. We're giving practical support to activists who are going to get involved in the new NHS structures that are being set up. And we're about to publish a report exposing private sector contractors involved in delivering NHS work. And next Saturday, we're hosting the annual Netroots conference, which brings together digital campaigners from across the progressive community. And this year, it's got NHS as its priority theme. One of the speakers will be the prominent NHS online campaigner, Richard Blogger, and you're all very, very welcome to come along. So we're working hard with health unions to expose the impact on services and staff of the government's cuts, reforms and privatisations. And we're continuing to build our All Together for the NHS campaign, an unprecedented alliance of TUC-affiliated unions and the BMA, the RCN and RCM and others, with a focus on local campaigning. And on the 20th of October, the TUC will be staging another mass national demonstration to resist austerity, to call for a new economy, and with the future of the NHS as one of our key themes. It's incumbent on all of us, unions, charities, professional groups, royal colleges, patient and community organisations to work together, because none of this is inevitable. NHS, staff, unions and communities, we can fight back. So let's build dynamic, flexible, community-focused alliances to defend our NHS. Let's get the message across that the NHS is already one of the most efficient healthcare providers anywhere in the world. And let's put maximum pressure, let's turn up the heat on coalition MPs to stop these greed-driven government reforms. I want David Cameron to be in no doubt that if the government presses ahead with its wanton destruction of our NHS, then he, his government and his party will pay a devastating political price. Friends, I see the National Pensioners Convention here. I see many people in the room who know more about the NHS history than I'll ever know. But you know that it was launched in the aftermath of the Second World War by a Labour government inspired by a generation of working people who wanted to build a better future for themselves and their children. They were people who no longer wanted to be afraid of growing old or becoming sick. They were people who rightly saw universal health care as a universal human right. And they were people who, in the bitter teeth of opposition from the Conservative establishment, stood up and fought for what they believed in. The National Health Service that Nye Bevan's generation built was and remains one of this country's defining achievements. And I want to be clear about this because it is fundamentally, in my view, a socialist achievement based on collective action. It's about the strong helping the weak. It's about everyone paying their fair share. And it's about everybody having the right to decent care. So it's our job to protect the health service from the forces of reaction. It's our duty to speak up for that post-1945 ideal of free universal health care. And it's our duty to defend the public service ethos that lies at the heart of our NHS. The arguments are on our side. The overwhelming majority of NHS professionals are on our side. But most importantly of all, the British people are on our side. So let's get active in our communities and our workplaces. Let's speak up for the values that make our health service special. And together, let's reclaim our NHS. Thanks very much indeed.